Good. You can let your finger go. All right, so we are here in beautiful Kohala Coast, Hawaii at the Mauna Kea Beach Resort. We're going to give a quick demonstration of our functional movement screen. I'm going to have John Cochran, our resident golf pro from Glen Abbey, who was gracious enough to bring me down to work with the members at Mauna Kea, do some of the examples, because we've got this annoying Pacific Ocean slamming up against the coast and it's a little loud. So we're going to switch spots right now. John's going to do some of the demonstrations while I'm closer to the camera to talk about what it is that we do. All right, so this is John Cochran. We are going to go quickly through some of our functional movement screens. So John's got a skipping rope. We usually use either a golf club or a dowel. We're going to go in an overhead position, arms nice and straight overhead. John's going to simply go into as deep a squat as he can comfortably. So what we're looking for here is a couple of things: depth, but also, are we able to keep the dowel or the skipping rope or whatever above our head? We'll see all kinds of problems with people having to dip forward. If you can't do this, if this is really, really challenging, John, get rid of the rope and just cross your hands over your shoulders. We'll get rid of the upper body challenge and we'll just do a simple squat with our hands crossed over our shoulders, or kind of hands in a front squat position, whatever. And we're going to see if that creates a big, big difference. That'll help to kind of differentiate upper body restriction from a lower body restriction. Again, these are very quick examples. We'd be going through a lot more testing to kind of differentiate this. That's great. Now, John, you're going to stand with your feet together. Okay, and then just nice and relaxed. I don't care how far you go, you're just going to bend forward as far as you can comfortably. Nice, good, and then back up. All right, so what we're looking for here is sequence. Let's try that again. We can see John's hips actually move backwards. He eventually gets a little more movement of the spine than we'd like, but at the end of the day, you don't have to forcefully lock your knees. We just want to make sure that we're able to create a hinge from the hips. If we had a golf club or a stick, we'd put it behind his back to see at what point does he start bending his spine. If we lead with our spine rather than our hips, it's a question of when, not if, we're going to start developing low back pain, and we just have sequencing issues with kind of our hip hinging. All right, thanks. John, come up. Good. Now we're going to go hands behind the back, one arm up, one arm down. Actually, turn, face the other way for me, John, just so we don't have the sun in our eyes. The annoying Pacific sun. Great. And then we're going to try the other side. We're going to see something a little interesting here. Not that easy. All right, so whether someone can touch their fingers together, I don't care. What's important is symmetry. John's had some issues with his right shoulder recently. And not surprising, we see that his right shoulder lacks the internal rotation that his left shoulder has. He had some surgery on his left shoulder back in the day, but that one seems to be pretty good. All right, and then relax. We can double check that by just turning to the side, bringing our arm up to 90 degrees. So we were looking at internal rotation. Now we're looking at external rotation. Can he rotate his arm from 90 degrees at the elbow and to the ground? Can he get it past his ear? Is he able to get his arm to rotate past his ear? And then turn around, face the ocean, John. Good, bring your arm up. Okay, you don't have to bring it all the way down like that. Just start from parallel to the ground. Parallel to the ground. Good. And then come back up and around. All right, so we can see that we're getting his forearm to pass his ear. He's got more than 90 degrees of external rotation of his shoulder. That's good. All right, and then while we're standing, we're going to just check our balance. Let's come up on one leg. We'll bring our knee to 90 degrees. We're going to see if he's able to maintain his balance for at least 10 or 15 seconds. Then once he feels comfortable, he's going to close his eyes. We're going to kind of evaluate with his eyes closed. Now we're testing intrinsically what kind of connection he has between his brain and the muscles in his foot, ankle, knee, hip, back. Very good. Switch sides. Again, I don't care so much how long you can do this, although we will have a minimum time in mind. John just had surgery on his left knee, so it's a big ask here for standing on the beach with his eyes closed, and we can see that there's a little bit of imbalance there. So he's come a long way in his rehab, but we're obviously not done, even though the pain is significantly reduced. All right, and then down, good. And now we're going to do a quick core stability test. Let's come down on all fours. There's all kinds of ways we can do this. We sometimes use a blood pressure cuff to test your transverse abdominis, but if we got no equipment, here's a quick way to do it. We're going to go opposite arm, opposite leg. John's going to extend his shoulder and his leg. What we're going to really focus on here is the curve in the back. Let's come back down and switch sides. In an ideal world, that lower part of his spine is really not going to move. I want all the motion to come from his hips, not his lumbar spine. Good, try that one more time each side. So we go from a nice straight spine to, we can see that little bit of that arch right there. That means we got a little bit of extra low back activity going on. Switch sides. It's not the end of the world, but again, if we want to kind of create more stable core, we're going to try to get a little less movement going from the spine. John's actually doing pretty good. Now we're actually going to make him really work. We're going to go same arm, same leg. So we're trying to resist rotation. The brain's got to think about it a little bit. And we bail. Let's try that one more time. Same arm, same leg. Nice. Good. And then switch sides. Same arm, same leg. Not easy. All right. Very good. So those are just a couple of examples of some of the functional tests that we use to kind of see just how well someone's body's working. From that, we can then come up with an exercise program and some corrective strategies to fix their, whether it's hip mobility in the squat and the forward bend, whether it's core stability in the cross crawl, whether it's shoulder range of motion and postural issues. We can improve and get their exercise program kind of on track where it needs to be, so we're identifying their biggest link. So once again, from the beautiful Pacific Coast in Mauna Kea, have a great